Brain surgery and spinal surgery tends to focus on the removal of the tumor in its entirety. In the past, we thought that this required larger incisions to fully expose both above and below an area of tumor and around its sides. As technology has advanced, particularly with microscopes and endoscopes, which are cameras on the end of long tubes where we can put the camera very close to the tumor itself, we've learned that we don't necessarily need a longer incision to completely remove a tumor. We've been able to work through small channels by putting the camera and positioning the camera right next to the tumor. For example, if my hand is the tumor, rather than looking back from far away and needing a big incision to see the full tumor, if you put a camera right next to the tumor in the form of an endoscope, it allows you to look around the corners without making an additional incision to look around the corners. The skin incision on the surface isn't necessarily, though, what makes the difference. It's the additional work that's done underneath in the muscle and the bone, and limiting that work can make a difference in the speed of recovery and in lessening pain during the recovery process. In approaching surgery for brain or spinal column cancer, the technology has advanced rapidly and continues to advance. This is true in both brain and spine, as well as peripheral nerve surgery. In brain surgery, there have been tremendous shifts in addressing tumors of the skull base and other tumors in appropriate circumstances. While in the past we would make very large incisions to approach the tumor, today we're often able to approach tumors with endoscopy. Endoscopy is something that's commonly used in other areas of cancer treatment. For example, most people are very familiar with a colonoscopy to look for colon polyps. We're now able to use this same technology called endoscopy to look into the brain through corridors that are natural, such as the nose, or other smaller surgically created corridors to look in at the brain tumor very closely with the endoscope and achieve surgical resection that is similar, if not better, than in past decades. Similar surgical strategies that we apply in brain tumors to limit the amount of surgery also apply to spinal column tumors. Traditionally, in past years, in addressing spinal column tumors, the surgeries were relatively larger than they are today. There is a large move towards minimally invasive spinal surgery. Minimally invasive doesn't mean that it's not invasive at all. It is invasive, but it is much less invasive than traditional surgical approaches. The potential advantage of minimally invasive spinal surgery is tremendous. This can allow the patient to mobilize much more quickly, have less pain, and be quicker to return to normal activities. The cancer patient needs to be able to get back on their feet as quickly as possible. This allows them to maintain their nutrition and their activities and their overall fitness, as well as the opportunity to get back to treatment.